Welcome back into the North Conway studio. Chris Prue here, this time with the staff of Memorial Hospital. We have Mary Vigeant, who is the co-chair of the Memorial Hospital Golf Tournament, which is celebrating its 43rd annual occurrence in just a little bit. Also, she's the president of the medical staff, and over here we've got the orthopedics team over at Memorial Hospital. We have brand new Dr. Josh Knowles, who's an orthopedist and specialist in orthopedic sports medicine, and Dr. Danielle Phinney, who's an orthopedist specializing in upper extremities. So we are very fortunate to have you all here and excited to talk. Let's start with golf. So the golf tournament, there are a lot of golf tournaments in town. This one is very special because it supports Memorial Hospital. We all know community hospitals are vital to the health of our community. And the nice thing about this hospital is every year it raises money for a new piece of equipment. So tell us about this year's tournament and what the money is going towards.
Thank you, Chris. And yes, over the years we've raised money for many different items, but this particular year we felt, given we are a true four-season community, we needed to emphasize and continue to grow our orthopedics team, but we needed a particular piece of equipment to help with that and to continue the expansion. It's called a C-arm, and they can speak to their utilization of it best, but a C-arm can be used not only in the OR, but also in the ER when they come, so it has a huge emphasis on their practice, and we're so glad to do it. We're really excited.
I want to talk about the C-arm in a second. I want to stay with you for just one more minute because you've been here, you've been on this show many, many years, and I know you've been at Memorial Hospital. What is your impression of, I guess, the work that this golf tournament is doing? You've seen it grow over the years, and you know that because of this, people don't have to leave the valley anymore to get specialized treatment.
That's true. This golf tournament is absolutely phenomenal. It's really a community event. It's not just hospital staff putting it together. Good folks like Paul Keene, the other co-chair for the tournament, as well as Gail Payne, a true love of the community. They all come together, and it's just a fabulous day. We are returning to Jackson, Wentworth. We will be having grazing on the green, which is a great time, a dinner buffet and all the awards to be given out under the tent. So we're looking forward to all of that. We are returning to shotgun start, which is lots of fun, all the carts going off and players at the same time. We have people that return from out of state for this event. They fly in specifically to come. And again, just a great sense of community. We're really looking forward to it and hoping that all the greens dry up.
I believe the field is full if you want to play, but if you want to sponsor, is there still an opportunity to get in?
Absolutely. So we have tee sponsorships, which are lots of fun, and many of the players take photos of them as they go hole to hole. And if you want us to join in the festivities, you can purchase a dinner ticket, which is lots of fun.
And all the funds are going towards the purchase of a C-arm mobile imaging unit. And I need to find out more about how this is going to impact my life because as I'm getting older, I think it's going to impact my life pretty soon. So first of all, Dr. Josh Knowles, welcome to the Mount Washington Valley. You are fresh from, I believe, the Air Force and most recently from California?
Yes, Chris, thanks. It's good to be here. My family and I are super excited to join the team, the wonderful team at Memorial, the orthopedics team. Just retired from the Air Force. I had a great 28-year career. I practiced orthopedics for 16 years there and had the opportunity to really focus on sports medicine and total joint replacement while I was there. So I'm excited to hopefully grow this program and be a part of this wonderful golf tournament. So,
well, thank you for your service. What's your impression so far of the Mount Washington Valley?
So far, we love it. We're very focused on outdoor activities. We love skiing, snowboarding, hiking. My kids are very excited to go to the schools here, which we know are super high. Top level. So. All
right,
yeah.
And Dr. Danielle Phinney, you've been with Memorial Hospital for about 3 years now. What are some of the things that you like to do here in the Mount Washington Valley?
I like to get outdoors as well.
Yep.
You know, my kids and I, we enjoy being out in the community, going to the parks and the playgrounds especially. So it's a lot of fun.
And the key to enjoying a lot of these outdoor activities is staying healthy. If you're nicked up or damaged, you're probably not going to do yourself any favors by either ignoring it or just thinking it's something that you can treat on your own or go away. Get an expert's diagnosis. What are some of the common things that you see at your office?
I see patients coming in with rotator cuff tears, biceps injuries, at the elbow, wrist fractures. I treat everything upper extremity related, but I also take trauma calls. So, we see patients coming into the ER with ankle fractures, hip fractures, it's a variety.
Yeah, absolutely. And you specialize in sports medicine. Are you seeing a lot of these same injuries and treating these injuries?
So the population of the military, there was a lot of complex knee, hip, ankle, shoulder injuries, and I just really enjoy taking care of those. Also really enjoyed doing total joint replacements on our veterans and our retirees. And so I'm excited to hopefully offer some additional services to help folks of the Valley stay close and not have to travel far for their injuries and their surgeries.
All right, so let's talk about these services and diagnosing. How is this C-arm going to help the Orthopedics Department at Memorial?
So we'll have more availability for the C-arm in the operating room so that there could be 2 surgeons working at once, each using a C-arm in one room. So I think it would be very helpful for that.
All right, and I don't know what a C-arm is, so what does a C-arm do?
The C-arm is something we call fluoroscopy. So it's almost like an X-ray that's portable. So while we operate, we're able to take pictures of the bones to make sure they're perfectly aligned.
Wow.
Without that, it's very difficult to see how things line up, and we can often do more minimal incisions with that equipment, so it's vital to what we do.
And this is in North Conway, New Hampshire, so many people may not even think of a small town in the White Mountains of New Hampshire is offering these types of services. Sounds like it's pretty state of the art. From the discussion with the administration of Maine Health and Memorial Hospital, I know they're committed to the latest and greatest technology. So that's our goal, is to bring that to the population of the Mount Washington Valley and to continue to grow our services to make it world-class organization. That's excellent. You mentioned Memorial Hospital is a member of Maine Health, so tremendous resources at your disposal. What if people are injured and they have a nagging shoulder injury, wrist injury? Does it behoove them to get in sooner, to get the diagnosis, to get the treatment underway? Because if you're ignoring it, you're probably just making a problem that could last a few months or a year, go on indefinitely or at least longer.
Yes, I think it's definitely helpful if patients seek care sooner, whether that starts in the emergency room or their primary care office, and then they can be referred to our office. Some patients are able to just call and be seen directly with our office depending on their insurance, but then beginning with sometimes physical therapy and injections, things like that. So there are different modalities, but occasionally surgery is needed as well.
Right. And can patients get referred to you from primary care not at Memorial Hospital?
Yes.
Perfect. Should they? So now that you know that they have state-of-the-art C-arm, you can advocate for that because we've got specialists here. Anything else that you guys wanted to talk about before we say goodbye?
Come out to the tournament. Come join us for sure. And if you're needing orthopedic, be reassured you've got first-class service right here, right at home.
Fantastic. So if you're out rock climbing, hiking, skiing, paddling, and something's not feeling quite right, we have the perfect place to go here at Memorial Hospital. And thanks to all the good work you have done over the years to help raise money for these great resources.
Thank you, Chris.
All right. Mary Vigeant, Dr. Josh Knowles, and Dr. Danielle Phinney, thank you so much for joining us.
Thank you, Chris.
You're watching Outside.